mind not only the patient's feelings, but also the patient's families and everything when you're trying to give them effective care. I picked trauma nursing because I have a passion for helping people, and it's also, as I've heard through my interviews, it's like an adrenaline rush. It's something that's fun, and it's different every day, and it still has a deep meaning to it. Also past experiences, my dad died in a car accident, and trauma nurses, if they were there, they could have saved him. I also always want to help people, and like I said, it's really exciting. Some basic information, there's time management is an extremely important skill for trauma nursing because you have to be able to triage, you have to be able to pick between which patient needs you the most, and how to give effective care quickly and move on. You also need to be very organized with your charting, and you have to be able to make quick and correct decisions and stay calm throughout the whole process. For your certifications, you need an associate's degree in nursing, a bachelor's of science in nursing, or a certification from a hospital. You have to be certified in emergency health administration, and you have to get a certification through the National Council Licensure Examination. Also, from what I've heard from the schooling, from all the nurses, it's the most difficult schooling aside from like being an actual doctor, because of all of the, it's very specific, everything you have to learn. In one of my articles that I read, what nurses can expect in 2014, they can expect a higher demand, expected to have, they will hire people with higher educations like master's degrees, which I'll talk about in a second. Holding influential roles on hospital boards, it's extremely important right now because doctors are the only ones on mainly the only ones on hospital boards, and they make all the decisions, but the nurses are the ones that actually see the patients more often, so they have more of an insight than the doctors do. It's also, there's a huge emphasis on a goal of patient happiness. Whatever makes the patient happy, you do whatever you can to get that done. I like the risky part of trauma nursing. It's fun to me because I don't want to just be sitting behind a desk all day. I don't know, it's fun. Dangers of being a trauma nurse. So there's overcrowding in like ER settings and stuff when there's a huge, like a massive casualty and a bunch of people come in. It's very stressful because the nurses have a lot of patients. There's a lot of chaos, and patients can become violent when they're stressed out and uncomfortable. There are also health risks. I'm not excited about this one because you can get like AIDS or whatever if you get stuck with a needle. And that's not as exciting to me as the chaos. As I said, I would bring up master's degree later. For nurses, you just assist doctors, record medical info, check vitals, and prepare patients. If you get a master's degree, you can become a nurse practitioner and have your own practice in a couple states. You have your own practice, prescribe medicine, treat illnesses, as long as you have a master's degree. Other specialties that I've been studying that are interesting me, aside from trauma nursing, fertility nursing, domestic violence nursing, oncology nursing, and NICU nursing. Fertility nursing, I think that'd be, if I wasn't a trauma nurse, that's something that I would really want to do because for the main part, everything's happy unless people can't have kids, but you're helping people have kids and fulfill their dreams. Domestic violence nursing, you're helping out people not just medically but also mentally, and that's pretty fun because I've always been interested in like therapy in general, but domestic violence nursing, you're helping people get out of an awful situation and you're providing support. Oncology nursing, it's a little sad, but if people are terminal, you're able to help them through their last parts of their lives and provide comfort and happiness for them. And if they aren't, then you're able to see amazing, recoveries, I guess. And NICU nursing is just really interesting because I love babies and they're really small, so it's like trauma nursing but for babies. Now onto my interview section. I did several interviews in ISM throughout the whole year, but these are just a couple of the ones that have been the most impactful towards my education. Nurse Nikki Wilk, she's actually the nurse at Lone Star. She's down that hall, she's right over here. She has been a pre-op nurse, a PACU nurse, a critical care nurse, and an endoscopy nurse, and now she's a school nurse. The hardest part of all of the jobs was dealing with families, she said. Families and doctors, you have to become the mediator between both of them. You have to be able to help explain what's going on with the patient, help explain to the families what's happening, what the doctor said, because doctors, they speak fast and they leave. Like I said, you have to be the middleman, and most nurses prefer high-intensity settings like trauma nurses. She said that's the one thing that she misses about being all the other types of nurse she was, because school nurse is pretty slow, but it's still rewarding because she gets to see kids every day. Nurse Melissa Whitehead, she knew she wanted to be a nurse when she became a mother. She's a NICU nurse, like I explained later, neonatal intensive care unit, where you take care of the babies. Each baby comes with different challenges. I believe she's the one that told me, maybe it's another interview I had, but yeah, no, it was her, who told me that the worst case that she's ever seen of a baby was that the baby was the size of a Coke bottle or Coke can, but it still lived because of all the health care that they were able to provide. The hardest part is when it comes to hopeless cases. Aside from seeing, for every case that survives, every patient that survives, there's a patient that doesn't. And the hardest part about this job was when the babies don't live and you have to talk to the parents who are grieving their newborn baby of 3 days. What advice she gave me